Hey everyone, this is Bobby from Mangiarelli Rehab. Today I'm just going to highlight again our rebounder and what we do for the throwing athlete. We're very fortunate to have this piece of equipment, especially for those who are going to return to any type of throwing activities. The rebounder is a nice way to start the process so that you can be able to go back and play your sport. So, you know, as we recover from any injury or surgery, we want good range of motion to be able to return to throwing, also good strength, especially with the rotator cuff. When we get the green light to start throwing, we will probably start to progress to doing the rebounder. So today I'm just going to kind of demonstrate some of the exercises. I have some of the athletes or the weekend warrior or the grandpa who wants to play catch with his grandson. So there's a couple of different levels that I might use the trampoline for. So I'm going to kind of demonstrate with the trampoline down. Sometimes this is an easier place to start for some patients. So what I might have to do here is start with a very light ball. So this is our lightest ball here. I believe it's just only 1 pound, okay? And I might just have them do just a small toss into the middle of the trampoline and just work on just like that elbow motion of throwing, okay? Obviously we don't throw from down here, but just to kind of condition the arm to get used to releasing the ball. So once we get that down pretty well, I'll probably progress to moving the trampoline upward. So from here, what I'll probably have most patients do is do like a side throw, okay? Just so that, again, we're just conditioning the arm to get used to the motion of throwing. So from here, same thing, I'm using a lighter ball. I might just work on doing a small toss to the middle of the trampoline, catch, release, okay? And we can change the strength of the ball to something a little bit more challenging, something a little bit heavier, something that works on a lot of control of the shoulder, okay? So this is a 4-pound ball, so it's pretty heavy, but the ball can come back a lot quicker, and I have to work on controlling the ball as it comes back, okay? As we progress along, we may have the individual just get on one knee to start working on an overhand throw, okay? So overhand throw, catch, getting used to that motion again. And then sometimes we might have the patient work a little bit quicker. And that way the shoulder can get conditioned before we start to maybe move outside where we would actually start throwing activities with a baseball or softball, okay? I know what you're thinking too. What about for the individual who doesn't throw overhead? Well, we also work on underhand throws as well, such as in softball, but also to my patients who like to play bocce. So here I have our 2-pound ball, which is very similar to a bocce ball. Okay, so for those who need to get back to playing bocce, well, we have you covered too, okay? Come and see us if you need work on your shoulder or throwing, and have a great day.